According to a leaked draft of a Supreme Court judgment, the country's top court is ready to eliminate the constitutional right to abortion, allowing individual states to restrict or ban the surgery more strictly. The landmark 1973 U.S. Supreme Court decision establishing a constitutional right to abortion in the U.S. is known as Roe v. Wade. Jane Roe, an unmarried pregnant woman, filed suit on behalf of herself and others to challenge Texas abortion laws. At the time, abortion was illegal in Texas unless it was done to save the mother's life. It was a crime to get an abortion or to attempt one. Many people think of Roe v. Wade as the case that legalized abortion. However, that isn't exactly true.
We know Roe came in the middle of a long-standing conflict about whether abortion should be legal and accessible. So in 1973, the court struck down really the vast majority of abortion laws then on the books in the country, and in so doing created the trimester framework that the decision became famous for. In the first trimester, women were allowed to get abortion, or the state had very little latitude to regulate abortion. In the second trimester, the state was allowed to regulate only for reasons involving women's health, and only in the third trimester could the state act on its interest in protecting fetal life. Roe also concluded that the right to privacy, which the majority was sort of a little fuzzy about where this right to privacy was, but probably in the Due Process Clause of the 14th Amendment, was broad enough to reach a woman's decision to terminate her pregnancy.
Although Roe v. Wade has been in act for about 50 years now, the abortion debate still holds so much controversy over the moral, legal, and religious implications of induced abortion. The argument in English-speaking countries is between the self-described pro-choice and pro-life movements. Before abortion was legalized, it was still very common, but it was basically suicide. No matter how you feel, it's just going to keep happening, but very dangerously. The methods were traumatic, and patients typically didn't have access to anesthesia or really any pain medication.
I just was in the position that every woman knows, on the table with my legs spread apart, and this man is inside me, scooping me out as if I were a piece of fruit or something with this implement.
I could not believe that I was seeing this. I just went home and cried. Someone gave her a hanger abortion, perforated her uterus and her bowel. And by the time she came to the hospital, she was in septic shock and she died.
They said, look, if you're pregnant and you want an abortion, this is the process. And I would have to basically say that I will commit suicide if I do not have this procedure. I said, I do not want this baby.
The pain was so outrageous that I do remember leaving my body. I didn't scream, but I do remember it was the feeling that I was up out of my body looking down on it.
I drove up with a friend to upstate Louisiana and had an abortion. He was an MD. The doctor said, you'll be in some pain, but it'll go away. The third day, I was still in a lot of pain. In fact, I was in more pain.
The second woman, a young woman who was really my age, who was the mother of 2 little children, and the family could not afford a third child, so she had an abortion. And within 48 hours, she died of tetanus.
The doctor had actually left in tissue that had, I guess putrefied may be the right word, and had caused massive infection in this whole area of my body. Peritonitis, it's called. And I was in the hospital for 2 weeks. The doctor said basically I was 7 hours away from death.
Because of the stigma, a lot of them were afraid to go to the ER, and so they just bled out. So that was the third person I saw who died of abortion in that short period of time in one little hospital in the middle of Brooklyn. And it made me think that there must have been a lot more than anybody ever said there was.
Even if someone does not have an abortion, if their pregnancy was not planned, it could have serious repercussions for the bearer and the baby. The CDC frowns upon it and says this: if the mom was not planning to get pregnant, she may have unhealthy behaviors or delay getting health care during the pregnancy, which could affect the health of the baby.
So when does the life of a woman and putting her at risk enter the calculus? Meaning, right now, forcing women who are poor, and that's 75% of the population, and much higher percentage of those women in Mississippi who elect abortions before viability, they are put at a tremendously greater risk of medical complications and ending their life, 14 times greater to give birth to a child full term than it is to have an abortion before viability. And now the state is saying to these women, we can choose not only to physically complicate your existence, put you at medical risk, make you poorer by the choice, because we believe what?
Research has also shown that unwanted pregnancies have many harmful long-term consequences for mothers and children, including a higher chance of financial hardship and a severe toll of mental health. And already marginalized groups will bear the brunt of the abortion ban. Statistics show that the abortion rate for black women is almost 5 times that for white women, and the numbers for other POC are similar. Experts say that without financial support for abortions, said women of color in states with restrictive abortion laws often have limited access to health care and a lack of choice for effective birth control. Their schools often have ineffective or inadequate sex education. The fact laws that have been in place for 50 years are changing is insane. That means anything could be overturned. Any of our rights can be taken at any time.
Question is, well, how does this impact other cases, right?
Sheetal Kalantri is a law professor at Seattle University. She says overturning Roe would, in her words, gut the constitutional grounds in which it was based on, which is privacy.
Now that you have unearthed the entire roots and the foundations of 30, 40 years of constitutional law, everything is up for grabs.
Here are some examples of what exactly is at stake. The Obergefell versus Hodges suit legalized same-sex marriage and used the right to privacy and the Equal Protection Clause to do so. Overturning Roe could open the door for states to test same-sex marriage laws. According to the U.S. Census data, in 2019 there was an estimated 980,000 same-sex couple households, and about 58% of those couples were married partners. For Grayson Schultz, a queer and trans writer and activist who coordinates care for included health communities, this possibility is scary. One other example of a law that could be in jeopardy is the Loving versus Virginia suit, which is a 1967 landmark civil rights case that struck down state laws banning interracial marriages. Overturning Roe could invite the Supreme Court to redetermine states' ability to ban interracial marriage. The Skinner versus Oklahoma suit is a 1942 ruling that found it unconstitutional to forcibly sterilize incarcerated people. Striking down Roe could once again put incarcerated people at risk for sterilization. The U.S. has historically forcibly sterilized incarcerated people as a form of eugenics, sterilizing approximately 60,000 people deemed to have quote-unquote undesirable traits. Even recently, a jail in Tennessee offered reduced sentencing for people who consented to sterilization methods. Still in effect, however, is Buck versus Bell, a 1927 decision that decided it is legal to sterilize people who are deemed quote-unquote feeble-minded or unfit to procreate. Like I said before, insane, right? You may think that there's no way that these things are ever going to occur in history again, but the exact same thing was said about overriding Roe v. Wade.